Hello, everybody. Good to see everyone. Why don't we go through some data, touch on some topics and a couple changes, and then take some questions. No new deaths over the last 2 days. That's good news. We've lost 207 neighbors during this process, and so certainly, hopefully, we don't lose anyone else. Looking at testing, happy to report yesterday the state updated the New York forward page related to including saliva tests. Now we're just trying to confirm that they're including all saliva tests, not just the SUNY campuses. But that gives us the accurate, you've heard me beating at that, as many of you report state numbers and say, why are Ryan's numbers different from state numbers? On the positive cases, oftentimes cases will get transferred out because of where the case actually is, not the old address. So those are always going to be a little bit different. Some days we'll have the same. Some days ours might be 1 or 2 more. The states might be a couple more. But the testing, the number of tests should always be the same. And so, or off a little bit based off of timing. So good news there. That will help give a clear picture of where we are. And so that's important. 7-day rolling average now, all of our tests over the last 7 days, 0.53%. So overall, even though the types of positive cases we have are changing, and certainly with new parts of reopening our lives, kids going back to school, there's different anxiety with different cases. But certainly when you look at where we are on a 7-day average, we're doing quite well. Hospitalizations up again today. We have 20 individuals in the hospital. We had, I think, 2 discharged. I think we had 5 new, or 5 new admitted. But nobody is in the ICU. So we have people who, again, are getting sick with the virus because the virus is here and the virus gets people sick. Right now, knock on wood, nobody is in the intensive care unit fighting the virus at the moment. When we look at some background information on who's in the hospital, 14 Caucasian, 3 African American, 1 of another race, and 2 individuals where we have not gotten their demographic information yet. Looking at positives, we've had 4,226 positive cases. That's 20 new cases since yesterday. What we've seen is this really, averages out to be about 15, 16 cases when you look at a 7-day caseload. That's been pretty consistent. Sometimes will be less, sometimes will be more. Out of the 20, what's it tell us? What's the story behind it? That's what the important part is. 3 travel related, all within New York State. 2 of those were out of jurisdiction cases that were transferred in. So those are individuals that lived in Onondaga County, most likely college students, went away to college, got COVID. They've come home to isolate. So when they come home to isolate, it's our job to make sure that they stay home, isolate, and get well. But when you look at the pressure on our infrastructure for contact tracing, these aren't cases essentially that we've had to do contact tracing on. Looking at community spread, 10, known source 6 out of the 10, 7 household contacts, so a big day of people within the household of a previous positive case becoming positive. Those are always going to be baked into our numbers once we have a positive case. Active cases, 190. That's up 3 from yesterday. We've had 3,834 people recover from the virus. Looking at who the virus has impacted, 2,414 female, 1,812 males, 449 under the age of 19, 874 in their 20s, 546 in their 30s, 515 in their 40s, 616 in their 50s, 456 in their 60s, 325 in their 70s, 281 in their 80s, and 164 in their 90s. Related to school, again, we've been asking and advocating for the state of New York related to kids that get sent home because of some sort of symptom, that we take a one or the other approach to getting kids back into school. Either they go to the doctor, and the doctor can send them a note saying they're healthy enough to go back, or they get a negative COVID test, which we think is probably the appropriate measure. Right now, what happens is you have a child who gets sent home. Some of the reasons they're being sent home are legitimate. Some of them are part of the learning curve that our schools are going through. And then they got to register for a test if they want a saliva test. There's demand for saliva tests. Why is there a demand? It's a test like this, not like this. So parents like the saliva test, but there's demand, so we're upgrading that infrastructure, and we'll talk about that. That does not mean that the parent can't go get a test at the Syracuse Community Health Center, the doctor's office, an urgent care, or the other upstate testing site on Water Street. There's plenty of places to get a nasal swab where you don't need to get registered. But if you want the saliva test, we're building up capacity, but there's demand there. And so we got to work through that as a community, and we are working through that. And then what happens after the test is the test results will come back in 24 hours later, essentially. That doesn't mean if you go in at 9, that's going to be back at 9 the next day, because all the tests go to the lab at 1 o'clock. So the next day, on Wednesday, if you get a test, late Thursday afternoon or evening is when the results will be essentially put up on the website or on a phone call being given to you. So that's kind of what's happening. So once you go through that, then you got to go get a doctor's note still. So to get to your primary care physician, whether it's telemedicine or not, the pediatricians are backed up now. So the process is not working well overall. So we're working with the state to try to fix that, let it be a test. There will be a process, and we have to get through this. The upside is your kids are going to school. They're learning in person to some degree, which is better than certainly learning at home, and that's benefiting your children. So we recognize this. We're working with everybody to streamline this. Nobody's ever been here before. So saying that, Upstate's working on expanding their capacity for saliva tests, but also their registration process. Folks will now be able to, starting tomorrow, to register for an appointment online using MyChart, which is Upstate's. If you're a patient at Upstate, you have a MyChart, and you go on there and you can register online. Also, if you are don't have a MyChart account, which you would have if you've ever gone to Upstate, and again, it's mychart.upstate.edu. If they haven't been a patient, you'll be able to make an account as a guest and register for an appointment. You must make an appointment for this testing. If you don't want to go through MyChart, which we recommend you do, you can call 315-464-2582 and select option 4. Again, Upstate has brought back more people to answer these phone calls, but there's still a wait time. They're getting thousands of more calls than they were getting before. So we're working through that. And again, a reminder, any child under 18 must be accompanied by an adult who can provide parental consent. Starting tomorrow at MBT Bank Stadium, there will be a second option for you. If you do not have a problem with a nasal swab for your children, we will have one of our other partner labs there for a second lane at MBT Bank Stadium, where we will be giving out the diagnostic or nasal test. It will be available for K through 12 students, faculty, and staff. It's for symptomatic individuals or those who have been exposed to the virus and have been directed by a medical professional to get tested. Appointments for this are not required, but pre-registration is strongly recommended to streamline the process. You can pre-register for the nasal swab at register.cayugahealth.com. Again, register.cayugahealth.com. By pre-registering, your information is there, so it doesn't need to be taken at the site. Easier to get in, get out. These tests, again, at 1 o'clock will all be sent to Cayuga Health, where our rapid testing machines work and run for results every 4 hours. So essentially, we know we'll receive turn times essentially within that same 24-hour window. So we have upgraded capacity for the saliva test with Upstate, updating the pre-registration capabilities to register online for the Upstate saliva test. We now are going to have the nasal swab testing there as well, so that if you can't get in for the saliva, you still want to get in today for a nasal swab, go there. At 1 o'clock, those tests will go down to the Cayuga Health. They will get processed in our rapid testing machines. Those are not the same antigen testing machines that you can go to Oswego or Pulaski for. These are the swab machines, more accurate. In 4 hours, they will come back, and then Cayuga Health's team starts notifying people about where things stand. So those are things we've done to upgrade capacity at MBT Bank Stadium. But again, nothing has stopped anybody in this process from going to your pediatrician for a test, the Syracuse Community Health Center for a test, the other Upstate site for a test, the Krause site for a test, St. Joe's for a test. There's testing everywhere. This is specifically, what's unique about this is we're earmarking this for school to meet this challenge, and what else has been unique is the saliva test, which is less intrusive for little kids. So obviously there's been a demand, and we're trying to address that as we all get through this process together. Looking at some other public health issues, obviously it's Breast Cancer Awareness Month. Breast cancer is the most common cancer among United States women, no matter your race or ethnicity. Mammogram is the best test to detect breast cancer early. Please don't skip your mammogram because of COVID-19. All the facilities have taken all the proper protocols to do it safely. We have free mammograms available through the Onondaga County Cancer Services Program, the CSP, for women between the ages of 40 and 64 who do not have health insurance or face other barriers to completing their breast cancer screenings. Free PAP tests are also available through the CSP for women between the ages of 40 and 64. Please contact our health department for any of these services at 435-3653, and so that you can better understand your options. But certainly, public health is a lot more than COVID. We still have lots of other things that we're dealing with. So certainly we wear a pink tie today for a reason, to bring awareness and take advantage of these marketing for these programs as well. One more related topic related to county government, and then we'll take questions. I'm pleased by the progress in stimulus talks. Certainly the Problem Solvers Caucus, the bipartisan group, have moved both the White House and the House itself, and hopefully the Senate at some point, to the table. They put forward reasonable solutions. The American people, whether it's local governments, whether it's people who are hurting or small businesses who are about to be put in situations where their business capacity may go backwards, need help. And they need help now because of the animosity in Washington, D.C. after the election, whatever happens. So we need these folks to do the right thing, get a deal done now. They're very close, 1.5, 1.6, whatever it is. It's going to help a lot of people, and that's your job. So I want to thank the Problem Solvers Caucus in the House. Want to encourage the rest of the House leadership and the White House to get a deal done, and then the Senate needs to do the right thing, and Leader McConnell. And that will help our situation, but it will help all these businesses that are really in tough shape here as well as so many other needy Americans. So certainly now's the time to get this thing done. Questions?
Ryan, at MBT Bank Stadium, both lines are still open 9 to 1
Correct.
daily?
Correct.
And is there a cost difference between the two options?
Both will be covered by insurance because it's still symptomatic or directly contacted. But we understand the need for speed when it comes to the way the regs are set up now. So we know that some of the folks going to MBT Bank for the saliva test probably have never had to get a test before. They're being talked about as an option. They probably will let their child get a swab. thousands of kids have gotten swabs, right? Just saliva is a little bit easier. So now we have that there. What we like about that is we know that our machines can run 25 tests every 4 hours, and Cayuga Health has more than just our machines there. They have multiple of their own machines. So we know by getting at 1 o'clock we can get our tests done each day down to start running the machines, and within 4 hours we'll have results, and then they'll start doing the contacting and updating it on the portals. So it's another fast way to get results out to parents, so then they can go and try to maybe do a telemedicine appointment with the doctors to get the doctor's note. But that's really the back end of the process that's frustrating people, right? Think about it. You're taking, you got to get an appointment. You didn't have to get an appointment, but it's the easiest way for the kid to get an appointment at MBT Bank Stadium. So you get an appointment. At times there's so much demand that the phone calls were going, the busy signal's going, you're on hold. Then you get it, you get your results back, but then you still got to go to the doctor. So, because the doctor's not going to rule you out for COVID on the front end, because you still got to get a negative test anyways. So they're saying, get your negative test, then come talk to me. So we got to streamline this. The state, we talked about it in our control room calls. I think the health commissioners have talked about it with Dr. Zucker. I think the state's looking at it right now, so hopefully we'll get some progress.
There seems to be growing frustration over testing, the options, the availability, the information around it. There's symptomatic and asymptomatic. There's covered by insurance, not covered by insurance. There's your doctor, urgent care, the county options, the hospital options. It seems that there's just so many options, so many variables, that there isn't one easy answer for anybody. What needs to be done to better market this, better organize this, so people know what category they fit into and where they should go if they need or want a test?
I don't know if I agree with everything you're saying. I understand what you're saying, but you have options to get tests, right? So maybe you're trying to figure out what's the best option. The best option is if you want a result and you don't mind having a PCP test done. Nobody ever had to go to MBT Bank Stadium for a saliva test. They could have gone 8 other places in the county. But judging by the feedback we've gotten from parents, is the saliva test is a better test where they're comfortable. So we make it available, right? So we do something good. Sometimes you get punished for your success and your intent. Because we make that available, everybody wants it, then the phone calls get backed up because nobody thought we were going to get as many as we did. So there's not a testing problem in Onondaga County. There was a testing problem in Onondaga County in week 1 and 2 of the pandemic. Sometimes when you get an antigen test, one of these rapid tests, where the 15-minute tests, sometimes when you get those, you have to go get a nasal swab after if it's a positive, because we got to worry about fake positives. So depending on some of this technology, you still have to go through the regular processes. So overall, what we now know is that related to this, there's increased demand for the saliva test. So by streamlining the registration process and not having a call phone number, that's going to help. And then also the demand, because we know there's the demand there now. We're in week 2 now, right? That capacity is going to be increased, so they can do even more per day. But also, we saw the demand overall because of the way that the child is being sent home from school. Some of these things, some of these examples of symptoms that they're being sent home for, we never anticipated that would be the case because it borderline COVID symptoms. And so now we have to deal with the overall demand. So we have the PCP testing there now too, and again, that's a 4-hour turn time on the processing of the lab for the test is rapid. It's not 15 minutes, but a 4-hour processing turn time is rapid. So that means that you're going to get that result back much quicker.
But
Brian,
you said yourself you've credited the asymptomatic testing over the summer. Where can people get an asymptomatic test and not be charged for it?
Well, that's not, again, the asymptomatic testing used to be covered by insurance. Now insurance isn't covering it. So you have to be surgical with asymptomatic testing if people don't want to pay for it. And so that's when you look at that, you need resources, Andrew. And so the county's not in the good resource business right now with what we're facing. So what we will be surgical with asymptomatic testing. And what will drive that will be looking at the data, which we do every day, and looking at zip codes and looking at neighborhoods. And if you see any sort of story that there may be any clusters there, you then go and do some asymptomatic testing there. We will be coming out with asymptomatic testing in schools. That will happen. But overall, the insurance companies have gotten in the symptomatic coverage business, which is unfortunate during a pandemic.
Do you worry that will kind of be a gap in the success Onondaga County's had?
No, I think the only way you get close to zero, though, and you'll never get to zero because we're walking and talking and interacting, but the way you get closest to zero is when you can do real asymptomatic testing. We're under 1, pretty remarkable that we've been under 1 and stayed under 1. But I think the reality is that we're now playing to stay at 1, around 1, under 1, depending on each day until we get the vaccine.
Last question on this. Have you picked up the phone, or have anyone with the Association of Counties picked up the phone to these insurance companies and said, we have success based on asymptomatic testing, you need to keep paying for it?
Oh, my message has been delivered, yes. Yeah, their answer is no. So I get it. No's an answer, not what you want to hear sometimes. And look at it, sometimes, my answer can be no sometimes down the road too. So.
You said that the rate's around 1 and you want to keep it there, but when you look around the state and there's a lot of clusters popping up and other regions seeing their positivity rates go up, does that concern you, or what are you doing to keep ours at 1?
Yeah, so you really got to study what's happening, and we just pulled some data the other day and looked at some things. So I've looked at what's happening in Rockland and Orange County and parts of Brooklyn and Kings County. There's a story there, there's a narrative there, it's impacting certain communities, and so and behavior within those communities. So that's the narrative, okay? So you understand what's happening, so how do you then get in and fix it? You have to change behavior. We haven't had that challenge here. So when we look at it, today, the last few days, very few cases related to schools. There's a little bit of activity at the end of last week and the beginning of this week, but that's slowed down. Colleges have slowed down for a period of time there. We had cases, so that's going to go through peaks and valleys, right? So you watch that. Household contacts, you're always going to have. Community spread, if you had a day where there's 20 community spread and 20 unknown, then you're going to find out, you're going to see that somewhere else. So it's really about contact tracing, wrapping your arms around it, and then continuing to test and quickly turn around those results. To Andrew's point, asymptomatic testing was a valuable tool for us to go from 12 down to 1, and now we have to be surgical with that because we're paying for it. And we, as everyone knows, we're running out of money.
Ryan, when it comes to contact tracing, I know it's brand new, but how do you anticipate the governor's statewide contact tracing app impacting contact tracing efforts here in Onondaga County?
Yeah, so I don't know. My assumption is that this app is getting the information on who was within 6 feet of somebody for 10 minutes from the contact tracers, right? So I don't know how else they would get that information. So I think it's just an additional tool potentially to be alerted before you may get contacted by a contact tracer. So you have the investigation, and I think this is how it's going to work. You have we learned about this same time you did. What time did you learn about today? Press release around noon. So did I. So what I think happens, you have your investigation. You then identify your people that need to get interviewed further to see if they've been and determine if they've been in close contact. I think what will happen is at that time that information then gets pushed through this database. So you may have already gotten a call from your contact tracer, or you may get a call, and this may be kind of a warning that maybe you should just quarantine and wait for a call and see what happens. But we're trying to learn more about it as well. So it could be another tool that could help expedite that process. And again, all these things, if you know, they can help with speed to get things done, you know, they could have some value.
Ryan, are you pushing toward some asymptomatic testing in schools soon, or are you waiting to see if there's a particular school that looks like it may have a cluster before you do something like that?
Yeah, we're probably going to roll out a pilot with a school on the asymptomatic testing program, and then build it off just from a regular standpoint. This is how it's going to work, and we go to every school and not really react to a cluster, try to be out in front of it. And so, because I think if we have a cluster in a school and we want to test every kid, insurance is going to probably cover that anyways. So what I want to see and what we're working on is looking at a way to do this, whether it's every 2 weeks or every 3 weeks. We'll let the epidemiologists and the doctors determine that. But get that done, figure out who needs to be tested. It would be the saliva test, so parents should feel good about it. And then we work, and that's the process. And hopefully you find it before it becomes a problem.
When you say every 2 weeks or every 3 weeks, are you envisioning something like repeated at each school that often?
I am.
That's pretty extensive.
It is, and that's why it needs to be well thought out, and you got to have the muscle and the partnerships in order to implement it. So right now we've developed ways to deal with this quickly as phase one of testing with schools, but to get in front of this even more, doing what colleges are doing is really what we should be doing with the buildings. And again, because many of these districts are on hybrid models or not even in-person learning, that gives you some time to implement that in a thoughtful and strategic way where it will deliver real outcomes.
When do you guess that might be?
I think the pilot will be up and running in short order. We're not quite ready to announce it yet, but it's coming.
Has the county gathered any more information about the gathering at the park near Salem Heights Elementary?
No, so here's the deal with this. I'm getting a lot of questions on this and stuff. We don't break, my inspector team doesn't break up mass gatherings. Okay, they're not trained law enforcement officers. So there was a wedding. They said that they had permission from the city. The city said they didn't give permission. Okay, the city SPD went there. We've asked for a police report so we could review the report and says what it has. Nobody's produced a police report. We don't even know if there is one. If there is no police report and we can't produce that, we will not do anything because we are not going to, based off of essentially hearsay. It's not hearsay, the fact that it didn't happen, but we're not going to go after the fact when the enforcement agency on the site didn't even issue a ticket or appearance ticket or anything and then come in after to have a fine or a penalty. So I've gotten questioned on this. I get it. It's kind of, it's kind of fun to talk about again, and but our role in this isn't there. We don't break up mass gatherings from the county executive's health department.
Well, this isn't breaking it up. Now, after the fact that it happened, can't there be some sort of fine or punishment like you do to a business if they allowed that?
But says who? Where's the report? There's no report that talks about what happened and what happened wrong. Why? Because people are putting it out on Twitter or whatnot? There's no report. So, and again, why we do things is we give warnings first to all of our businesses. When we have a bar or restaurant, we give warnings to change the behavior, to help us with this, to change the behavior. Was a warning issued by the police who were there. So that's the appropriate thing. And did they go and did it break up then? I don't even know that. I didn't live in the neighborhood. I know some people there did. I don't know those answers because I haven't seen a report. We've asked for a report. We were told there isn't a report. So if there's no report, the county government's not going to play a guessing game. We weren't there because if we give a ticket, it's not going to hold up in court.
At MBT, Ryan, do you have a rough estimate of how many people during that 4-hour window each line can accommodate?
So I think each day we're planning right now. every day about 100 people can essentially get through the saliva testing right now, where that capacity next week will hopefully be up to 150 to 180. And then we have talked to Cayuga Health about 100 people a day from 9 to 1 through their line as well. So looking at probably about 250 people a day right now at MBT. And again, it's a big parking lot. We can expand that if it continues to be an issue. And we can look at expanding hours too if our partners can work with us on that. But again, the key to, from an infrastructure standpoint, at 1 o'clock is good because then you can go to the labs when the machines run and you can get these in and then you can start getting them turned around. So to really do more time there, you would have to still build up more infrastructure for personnel to still be able to do that and then have your second batch later on. So it's something we can do, and if we will do if the capacity still isn't enough to meet the demand.
And the one line, I assume, will be staffed by Cayuga Health as opposed to Nascentia?
So Nascentia is a partner with Cayuga Health too, so they're going to be doing one line saliva, upstate saliva test here, this line for your nasal swab. And then, again, you don't need to be registered to show up for the nasal swab. It's better if you pre-register, but you don't need to be there. Essentially, you can get pre-registered there. It will just slow things up a little bit. So we encourage everybody to try to pre-register.
Earlier this week, I asked the governor about Shoppingtown Mall. Have your lawyers, the county lawyers, gotten back to you about if they agree with the governor's counsel that those tenants are protected by the executive orders?
We do agree with that. I think it's a functionality standpoint, though, Andrew. I think the governor's order stops the process in the courtroom, right? So you could have Moonbeam here being slick again, and so they can essentially, it's not operating now. They haven't even changed their filters, and so are these folks, these poor business owners, going to now go and fight these folks in court and sue them to let them back in their own building? Now we might look at this and. If Moonbeam wants to lock the doors and not let people get their material, we want to hear about that because we might just bring the sheriffs over there and deal with it that way. But so people can get their property. But it's very slick what's being done here. And again, this doesn't surprise any of us, right? That they would behave like this. So, but we'll work with these tenants. Hopefully, these tenants will find other places to operate out of. So they can see some light for their businesses.
Would you elaborate on that a little? I have the same understanding as you about it being a court, that the executive's order affects the court process, so Moonbeam can still tell them to get out.
Yes.
But do you think that there's strategy on Moonbeam's part that they know they don't need a sheriff to come in and lock the doors because the doors are already locked from the pandemic?
And my understanding is that they might have already locked some of these other ways that folks were getting access to their space they were paying for as well. So if Moonbeam's telling any tenant that they got to be out in 30 days, is that legal? It would get blocked in court right now. Could they still be locking the doors and not letting them in? Yeah, I think they are. And if they aren't going to let people get their property, then maybe we'll have the sheriffs go over and deal with that to get their property.
Is Moonbeam still under that tax payment agreement they worked out?
Yes, and they have been making their payments to us, $25,000 a month, and we are. And what's so weird about this is there's activity now in this process in the bankruptcy court, and remember they're in bankruptcy court, so their argument to the judge is I need my costs to be lowered and restructured so that I have enough revenue to pay my bills. Well, they just eliminated all their revenue. So their argument is just really ridiculous at this point. But again, this is like the ultimate Groundhog Day episode with these folks. And this movie's going to end at some point in the near future here.
That's the second movie reference you've used. The Grinch was your first movie reference to Moonbeam.
It might not be my last with this soap opera.
A judge, I think yesterday in Western New York, ruled that the state liquor authority couldn't say that you can't advertise live music. Do you have any more insight into that? Did you talk about it at all?
We have. We've asked. Whenever there's a court case where an individual is suing the state related to Restart, we don't lean on the state's assessment and their lawyers for the interpretation because they're a party to the suit, right? So we've asked our lawyers for an opinion on that, whether that just pertains to that individual business, whether it just pertains potentially to that district, judicial district in those communities. I don't have that yet back, but certainly the state may appeal it, just like they appealed the capacity for hospitality events as well. They asked for a stay on that. So we're not willing to say to some of these businesses in our community that they can go operate right now based off of this decision. We want to understand it and then be able to give we will never give legal advice to them. Their own lawyers would need to do that, but we would, based off of our legal opinion, we would then take that into consideration for enforcement of the rules and regulations.
Ryan, there's a big election coming in a month that obviously is going to be heavily impacted by coronavirus, and I know our local board of election is working hard to make that work. And you know, President Trump is doing his best to sow doubts about whether it will work. Have you seen anything locally that gives you concern about our ability to have a free and fair election?
No, first off, we held harmless BOE related to some of our furloughs, and B, there's grants that we've had that we're now utilizing to pay for some of the workers to deal with the absentee ballots. What I think is important for people, because everybody gets in this on this issue, everybody gets half the story from no matter who's talking about it, right? So in New York State, you don't just get a ballot mailed to your house unless you ask for it, right? So what some people say is in other states they do true mail-in voting based off of information, so you don't need to ask for it. That's not what's happening here in New York. So you don't need to be worried about that. The only way a mail-in vote's happening is if you ask for it and you want it, and you ask for it, it's coming to your house, and then it's your job. You're going to get it, and you're going to get it in a timely fashion. Then it's your job to get the ballot back in. And in addition to that, remember there's early voting. So there's 6 early voting sites that are throughout the county, open, and you can vote early in person. And so by doing the absentee ballots and then voting early in person, that de-densifies Election Day. And so then you have Election Day, right? And I'll be voting on Election Day. That's what I like to do. And so between all of this, everybody's going to have ample opportunity to vote. We've made sure that everybody's going to get their ballots in time so they can get them back. And some of the anxiety being talked about in this national race just it doesn't happen here. It just hasn't happened here. Nobody's ever questioned the integrity of elections here, and they're not going to be able to question that in this county this year. Anything else? Trish?
Have you gotten tested?
So I'm going to do a saliva test, Trish. I'm going to go. We're going to have it scheduled. I'll even have it video for evidence for you. And then, I got a busy calendar over the next few days. So unless I come down with symptoms over the next few days, I won't be doing it. But it's time. We have this unbelievable upstate test for saliva, which helps with my anxiety of the nasal swab. So I'm going to go get that done, and we'll have evidence for you. Does that sound like a deal? Have you gotten tests is the big question.
I have not.
Okay.
I also have not had symptoms.
Okay, good.
But
good.
I have given blood, and they test you for antibodies, and I don't have them. So I wasn't asymptomatic at
It's
all.
good to hear. That's good to hear. Any other questions? All right. Thanks, everybody. We'll see you on Monday.